All right. So, welcome everyone to this month's Tech Tank meetup. We actually have a really cool panel for you guys today called Engineering Wellness. We're going to talk all about the things going on in health tech. We have an amazing panel for you guys. Yeah, just wanted to welcome you. Let's make sure this works. All right, awesome. All right, so today's panel is being recorded. Obviously, you can see Neil there with the camera. At the end, if you guys are asking questions, just a heads up, generally we're not going to have a camera pointed at you, but your voice might be caught on there or your question might be repeated. Alongside that, we are doing photography at the event, so you might be captured potentially in the background, and hopefully that's okay. So just want to let you guys know. So, Tech Tank, we have been around for a bit. See a lot of familiar faces in the crowd, so most of you kind of know who we are, but we are a lively and inclusive tech community where we wholeheartedly embrace tech enthusiasts from all walks of life. We're all volunteer run. We're not like some formal funded nonprofit. Everyone who kind of helps us and does these events, including all the social events, if you've been to those, it's all volunteer. There's 6 of us that are kind of admins of the group, so you'll see us kind of around the crowd. But it's not just usually me that kind of makes these things happen. We all kind of show up early, we stay late, we do a lot of stuff to make this happen. On top of that, to throw these events, it takes more than even just the 6 of us. We have, these are the volunteers that came and helped. You probably saw them running check-in with food, helping you find this amazing venue from the outside, which it is amazing. It can be a bit of a challenge to find, so hopefully you guys didn't think you were going to a cult and getting murdered, but that also is not the case. Anyways, I did want to actually ask for a special round of applause for these volunteers because they come just for the events and they're really the only way we can do this. Okay, this one, I hope most of you know that you came through Meetup and that's how you got here. But if you somehow were invited by a friend or showed up without going through Meetup, come join the Meetup group. We do a couple events, some virtual, some physical, every single month. So you can grab that QR code or just find us on meetup.com. You can also find us on LinkedIn where we have, again, events or postings about our events, including other thoughts, other presentations. But this is new. We now are on Instagram. We have a really awesome social media team. So special thanks to Sophia and Amanda who've done an amazing job at sort of spearheading that. This is the first time we're showing this. So if you aren't connected with us on Instagram and that's how you choose to engage with community, come follow us on Instagram. Slack. This is the final QR code, I think. I think about half of you are probably in our Slack group. We do a lot of events and other kinds of activities that are not sort of available to the public. We call them just available for members, including a big barbecue that's coming up in June. We do virtual events. We do, like, if you're looking for a job, we do job hunt buddies. We've done interview practice. We do workshops, all sorts of stuff that's only kind of announced in the private Slack group. So first timers, just raise your hand. I'm just kind of curious to see how much of the crowd is new. Awesome. Okay, that's pretty typical, about half of you guys. Awesome. That's actually kind of funny. I met some of you at recent events, and they're like, oh, we have this thing called Tech Tank, and then now you're here. It's awesome. It's called recruiting. Anyways, if you're interested in speaking or being part of a panel, everything that we do is sourced from the community. We're really about promoting the technology community within Toronto. Fill out the form at that QR code, or just you can go to techtankto.com/speak. Essentially just gives us your information so we can have a conversation with you about how you can get more involved. If you're interested in hosting, so hosting meaning hosting a physical event like this, or if your company where you work, you're like, it would be super cool for us to do, maybe you have a manager or you are the manager who could sponsor something like this, that is again how we're able to do cool events like this. And we're gonna hear a bit more from our sponsor for today in just a second. Closing time. So after we're done, everyone loves hanging out, and we would love for you guys to hang out, so we do this, but we need to be respectful of the space that we're in, so we are going to kick you out, like a hard kick out at 8:30. That doesn't mean the night's over. We will kind of announce a bar. There's a ton of them around here that we can all kind of go to and continue our conversations, but just allows us to kind of clean up. But I'm just going to say this again. Every single month it happens. When we start saying, hey, please leave, you got to leave before, if Dre's here in the crowd, they will yell at you. So, all right. If you love what we do, again, we're kind of an all-community run organization. Yeah, please consider helping us, and you can donate. Again, you're able to kind of come enjoy the food, come enjoy the drinks, and we don't take any of the money ourselves. It's really just that we can make sure we can continue doing events for the community. All right, so our sponsors. So today's sponsor is Seven Shifts, and to an extent, Roof Garden. And I'm going to have Luke come up and tell you a bit more about Seven Shifts.
Thanks, Riaz. Hello, everyone. Yeah, I'm Luke Galea. I'm the CTO at Seven Shifts. We're really excited to be sponsoring this event, but I also wanted to thank our hosts, Phil and Nat from Roof Garden. Thanks for hosting us here. It's an amazing space, and yeah. So, who is Seven Shifts? Oh, this is the wrong slides. So I will fill time while the slides switch. No. But anyway, I promise I'll be brief. I just wanted to tell you a little bit about Seven Shifts and a little bit about the food that we're eating, because they are related. So who is Seven Shifts? We started a little over 10 years ago when our founder, Jordan Bosch here, was working at his father's Quiznos restaurant. And pictured here is their schedule behind them, all paper and crappy. And he thought that there must be some better way. So he wrote some software. It was like jQuery PHP in who knows what year, 2004. But ultimately, in the years since, we went on to schedule over 440 million shifts on behalf of restaurants in North America. And today, 1 in every 8 restaurant workers uses Seven Shifts to schedule their shifts or trade them or what have you. Including Blondie's Pizza, who provided the food for us here tonight. So thank you, Blondie's. I don't think anyone from Blondie's is here, but Blondie's uses us for all of their team management. It's because our mission is to simplify team management and improve performance for restaurants. And our vision is to elevate the standard for what restaurant teams can achieve together. And that's because we believe that bettering every individual in the restaurant makes for a better team, which makes the customer's experience better, which gives the restaurant a major leg up on their competitors and ultimately makes for a better restaurant. And the problem that we seek to solve is all of this, like the nasty paper forms that really dominate most of the restaurant experience for employees these days. And so we have an all-in-one team management system built for restaurants. So we do hiring, training, scheduling, paying, and retaining. And again, I don't imagine any of you run restaurants, but if you do, you should consider it. But I will say that our staff are all over Canada. We are headquartered in Saskatoon. We have an office in Toronto, but it's not big enough for an event like this because we're primarily distributed. So you can kind of see like about 46% of us are in Saskatoon or the prairies broadly, but we're kind of all over, which makes it hard to host an event like this because there's no one place big enough. So again, big thanks to Phil and Nat for hosting. On that note, though, again, I'm not here on a recruitment mission. I'm here really just to support the event, but I will say we are hiring. We're hiring in customer support, engineering, finance, marketing, product. So I think that they'll circulate the QR code there. Seven Shifts is awesome. You should think about it. I don't know. But on that note, you might be wondering, like, why are we sponsoring an event on wellness? And I'll say, first of all, once upon a time, we actually offered a scheduling product for the medical and like clinical community. And then we learned that you need to focus and that there's a big difference between a hospital and a restaurant. And so we doubled down and focused entirely on restaurants. But we still have a soft spot in our heart for health tech. Beyond that, I also kind of got my start in health tech. So just very briefly, I started as a developer during the .com era, and I worked on kind of pure tech for the majority of the early of my career. So I was effectively making tools that other developers would use that maybe somewhere down the line would eventually impact someone in some way. But I felt, well, bluntly, I hated it. I felt like I was writing tools that would just help a developer save a little bit of time instead of actually making a real difference. And so I kind of drew a line in the sand and decided I was going to chase impact from there on out, and that led me into healthcare. So for years, I worked for UHN, Toronto Rehab, a whole bunch of different like hospital networks. I worked in medical research. And I'll say that like working in health tech was everything I hoped it would be. I immediately got that sense of impact that I didn't. But more than that, it also exposed me to kind of everything. Like today, 7 Shifts is effectively team management, nutrition, and scheduling. And my first exposure to all 3 of those things was working at a hospital, right? Like we had a nutrition department and had to make food for people. And we had to schedule people and do like admission, discharge, and transfer tracking. And team management is like the core of most of like nurse management or nursing management. So all that to say, I loved working in health tech. I'm really excited to hear the discussion today. I don't know, thanks everyone for coming. Cool.
Thanks, Luke. All right, so we're going to get to the panel now. I'm going to invite up our lovely panelists to come join me. Awesome. All right, so what's something that maybe surprised you about working at a company that dealt in the health universe that maybe you didn't expect?
Regulations, like at least in the US side, one of the things that they talk about is a provider has to be, regulated and like certified in different states. So each state they have to get recertified. So even though you may be doing some special thing and you're available online, you're still not available for someone just across the border by like a few minutes, right? So some of those regulation issues are there with HIPAA as well. But the other part of it is a lot of the health industry, like tech that pre-existed before the pandemic kind of, wasn't really meant to be integrated with other systems and stuff. So like one of the cool things about Healthy is like, we try to be API first, which means we expect other people to ping our API and integrate with us and like use us to build other things that would help, I think something was like prescription management or something like that, do other cool things with us. That's not how a lot of health companies are built. And there is a lot of like loopholes you have to jump through. So then again, it's not so much a tech problem, it's more people problem at that point.
I feel like we're saying things, here's things that don't potentially work really well where we can improve them. But like, if you look at things that maybe are working really well, and you touched on this a bit about like the changes we've seen in telehealth adoption since the pandemic, right? But now we're a few years beyond the pandemic, and I guess sometimes things can rise up really quickly and change. How have any of you seen post-pandemic, what are the things that have kind of stayed and what are things that are like continuing to change, that you still see in a positive or negative direction related to how we deliver health?
I think for the telehealth stuff, that's still booming really well. Like before pandemic, I think we'd have had to, I think our CEO always likes to talk about how when she was first pitching it, she had to like actually explain what telehealth was to people. Whereas now everyone knows it. Right? It's just, of course you can schedule an appointment. Of course you can email your doctor, right? Or chat with your doctor. Like that's just normal now. So there's a huge market for that in that sense. A lot of adoption, especially for like hard to like find places, right? Like where there's not a lot of doctors available, it becomes a better way for like people to get service, right? Yeah, I'd be interested in seeing how that helps you guys.
In emergency, we use it a lot. So at my hospital, we don't have a stroke neurologist on site at all times. So we have to refer our patients to Hamilton. And so the stroke neurologist can assess these patients through a screen, see what their neurological deficits are and start treatment at our site remotely. We also use it to collaborate on resuscitation. So our hospital is not a hospital that sees a lot of very sick pediatric patients. So, because we don't see very often, we're pretty anxious when it comes to these cases, right? So it's helpful to have backup. And we have critical care physicians in McMaster who collaborate with us. They see the patient through the screen just like we do. They see what we're doing, how we're resuscitating the child, and they guide us, they help, suggest medications and recommendations, and it's really nice to have that kind of backup. I think we need to use it more. I think a lot of hospitals don't have all the specialties, right? We don't have neurosurgery. I think more of these patients, trauma patients, could be assessed remotely. So I think there's more opportunity to use this for sure.
I think that was a way to use telehealth at all. Yeah, I did not think that was another way to apply telehealth, actually, like being able to like have doctors itself, because like ours does allow chat between different providers if they're all in the same like, you know, sub-organization or whatever. But like I did not realize how critical that was.
Okay, so I want to think about this maybe from a different perspective, right? Because we've looked at like the way technology companies are implementing telehealth, how clinicians are maybe using new technologies, but like the other side of this that's a critical factor in the whole industry is companies, right? Because a lot of our, even in Canada, right, you usually get supplemental insurance through a company or supplemental programs, and that's kind of what League specializes in to an extent. And I know part of the pitch is this notion of personalization, using it to find ways of improving health specific to a person. Like, maybe you can talk about, Marta, like a little bit of how we've gone from maybe just the clinical system, just looking at a patient versus looking at how do you treat people more specifically, and is some of that more coming from, you know, companies in these programs versus maybe the formal medical system?
Okay, so two caveats here. League isn't really in like a medical system business. It's more like personal stuff, and also I'm just a web developer. I don't really listen to the business stuff. But from what I've seen, definitely over the years, like from like implementation perspective, our data team has grown from one person to many. I don't know the exact number, but now we have 2 data teams, not just one person. We've integrated Fire, which is Google's something database format for sharing health data across different databases, so it's easier to share it with other providers. And definitely we're super into personalization because that's what the value is. Like if you have if you had PC Health app, or an app that just like tells you every day to like eat more vegetables, walk more, you might be like, okay, I already know that. So then if it's more personalized because you answered some questions and it's like, oh, you can't sleep very well, how about you try these things or those things, and then you can get points from PC and buy some stuff with the points. That's where our leadership sees value. So yeah, there's a lot of data collection, and the data is anonymized. And yeah, that's what's happening. A lot of analytics to implement pretty much any button, anything we do now, we have to implement an analytics event, yeah.
I think this is broken. I think the cool part we also have for us is like we allow our patients, like our providers' patients, to have their own portals. So the personalization part, like, because we originally started out with nutritionists and, you know, therapy and stuff, and now we've gone into other practices as well. So like you do get to like have a lot of say in like, I would like to like monitor more of this and all of that kind of stuff. But yeah, I think right now it's all, the game is data, to what Marta was saying. It's just, how do you analyze all the data we now get?
Well, Marta brought up one thing that I've always been really interested in, which is interchange, right? You talked about like the format that's being pushed to kind of allow interoperability, and I kind of have a little bit of personal insight into this because when the Obamacare law was passed way back when, right, one of the clauses was in the US side was this requirement that the government create this interoperability standard. And I, at the time, used to work at Deloitte in the federal practice, and one of my friends worked on a team that was supposed to help establish the standard. Now we're way farther away, and we're obviously in Canada, but this is still, it sounds like a really big challenge, which is just moving records to the right place so that your physician or practitioner has access to all this context that already exists about your health. I don't know, Roveena, is that obviously in an ER context, you've got the least amount of time to get access to that. But is there anything that's improving to give you quick access about, someone's health background?
This is like one of the things that really makes me mad about the lack of communication, like how each health network acts like a silo. So I'll just illustrate an example. Like, imagine you're a patient, you're a 30-year-old male, and you've had an organ transplant done in Toronto, and then you decide to move to Niagara, and then one day you develop shortness of breath, you go to emergency, and you expect that provider to maybe have your records of all these complex surgeries that you went through, the transplant, and that's not the case. Like in Niagara, you're just 2 hours away, but you don't have access to any of the records from any of the hospitals. So and God forbid, you present in the middle of the night, and I can't call your family doctor's office to have those faxed over. So, I think we have a lot to do in Ontario. In Alberta, they do actually have a system where a healthcare provider can access your records all across the province. And we need to move to a Canada-wide system. If anything, it would be nice to have it attached to your health card. So, no matter where you move throughout Canada, your healthcare provider has access to that information.
So one of the things I kind of find interesting about this dynamic is I feel like there's some challenges in the formal structure, but if you think of outside of that, right, like almost all of us have probably an iPhone with Apple Fit, which is tracking our heart rate and our steps, and it's actually one integrated system. And there are these amazing tools that let it integrate with almost any of literally if I just want to challenge my friends to a step challenge, Neil, I'm looking at you wherever you are. We can do that collaboratively, right? But if it's within the medical system, we can't. And so, one of the thoughts I kind of had is sometimes people kind of hack things outside the system. And this is maybe happening to a pretty significant extent where people are biohacking. They're trying to figure out supplements they can take. They're looking at some Instagram feed and deciding what to do. There's in Canada, continuous glucose monitors can be bought over the counter. So people are like, oh, I'm just going to go track my own stuff and then show it to my doctor. Are you guys seeing any of that? Is that anything that maybe even at a business level, any of your products are hey, how can we kind of think that way? Or even in the formal system, are doctors oh, it's kind of cool, I maybe get access to this data, even though it's not coming through the former medical record system?
We integrate with Fitbit and AppSync and all that wonderful stuff to get the same data and sort of help with the personalization part of it, right? Integrations is one of the things that we actively do because we started out with nutritionists, right? Now we do a lot of other stuff. So we sort of got the taste of that and the amount of help that provided our customers better treat their patients. So we kind of try our best to do that still. I think now the part that we struggle with is not so much, oh, we have this data, but how do we now tell somebody else in a different state who doesn't use our application the same data?
I can imagine there's potentially a negative side to this too, right? This whole self-hacking outside the system. I mean, it's great in your maybe tracking, Apple isn't going to inject you with something when they're tracking your fitness metrics. And I'm sure there's privacy concerns with that. But there's probably also a negative side of someone, oh, you can eat the extract of some plant and it's going to make you lose weight. And then they show up at the ER because they didn't think it's poisonous. I mean, how much of that do you see that is maybe something that's negative about this trend?
I mean, I can understand where people are coming from, right? The issue with our healthcare system is it's not the end all and be all of health, right? People want accessible care. They don't want to have to wait to see their doctor in 2 months, right? So, they want to take it into their own hands. So it's easier to buy supplements on Amazon, with the click of a button, you get it the next day, versus seeing your family doctor in 2 months. I can see where they're coming from. But the issue is there's little in terms of tools to distinguish what's helpful, what's actually going to be beneficial for people's health, right? A lot of these things may not be evidence-based and may cause harm. And unfortunately, people fall under the influence of really smart marketing campaigns, right? So I think, also medicine is, changing, it's evolving, right? So I think maybe over time, maybe if we have more evidence behind these things, maybe they will make it as part of mainstream medicine. Definitely with regards to wearable technologies, I was gonna say, like, I went to a conference last week and there was a talk about how smartwatches were accurately detecting an abnormal rhythm called atrial fibrillation. And this has a huge impact on patients because this rhythm predisposes to stroke. So if you're catching that rhythm well before that you see that patient with a stroke, that's a huge, you're saving lives there, right? So I'm really excited, with these wearable technologies. With diabetes, there's a lot of people now on continuous glucose monitoring, and their endocrinologists are using that data. I don't know if my mic is okay. They're using that data to help guide their care. So I'm excited about the future.
Yeah, I think, Marta, you talked about this, about like the notion of accessibility and user experience actually mattering a lot at League versus other places. Is that something that, like, specifically even within accessibility, I mean, do you see that, like, empathy for the user kind of permeating through the organization there versus not other places? That kind of like leads to, that kind of is why someone wants to use a continuous glucose monitor, right? Which is like seeing their doctor in 2 months, but it's like, oh, I just get a usable tool on my phone to kind of track the same thing.
How do I phrase that? I think that when you're a private enterprise and your users' satisfaction directly translates to your profit, then you are going to make Hello? Okay. Then you're going to make your user experience as good as possible so you can continue selling your app. And if that user satisfaction isn't an incentive for isn't related to your profit, let's say you're a government app or you won some contest for a hospital app, you are going to have terrible UI because it doesn't matter if I can find the data I need in a hospital app if I didn't pay for this app, and I won't be the one who stops paying for it. And so, yeah, I don't have a lot of, experience with other places. To me, like, League is like, yeah, you have to make your app, like, before when we were even more into benefits management, it was a huge thing to always kind of rewrite descriptions of different benefits, like your vision, your dental, what's covered, what isn't, to make it like in human language. So it's actually easy to understand how much money you have for your glasses and not some kind of like, small print. And then you find out that you actually don't have anything covered. So yeah, I would say that League is empathetic because because of our business model, we are allowed to be empathetic, like, to users, and we can make feel-good things.
That's awesome. So I'm gonna switch gears again, and we're gonna talk about AI. So it's obviously in the zeitgeist, right? Like, I think Google had their Google I/O just recently, and they even made a joke about the fact that they talked about it 120-something times on stage, right? Are you guys seeing that actually practically permeate, like, the technical decisions coming down the line of what you guys are going to actually build? Is it like something that you could see even the twinklings of having more direct impact inside the clinical space? Or is it more, hey, it's really cool, everyone has ChatGPT, but like, you can generate really funny poems and music and whatever, but we're not currently still seeing it have a day-to-day impact or seeing how it could impact your lives right now, beyond helping you code, right? I mean, that's the one that could kind of be more direct.
So I do think, like, yes, we are all thinking about it. I don't think it's a fad. I think it's coming to stay, and it's going to change a lot of ways we think about work and software and stuff. Honestly, beyond it starting on the health side, I think the first impact is going to be the software engineering side. So like how we as developers write code for these health tech pieces, right? Because honestly, with health tech itself, like those things move a bit slower because we have to be worried about HIPAA, we have to be worried about all these regulations. So how we integrate that, how we add that, we gotta be very, very careful. Especially because AI can be really, really smart and really, really dangerous if not. But on the flip side, how we write code, how we write new features to help our patients and clinicians do their jobs, that I think is where AI is going to change a lot of the workflow, right? So instead of even the data analytics part, how like actually understanding all of that complex data when it's anonymized and stuff, I think it can be really helpful in filtering that out to be, you know, human readable and usable.
So yesterday at lunch in the office, we had a workshop with Gemini. League works with Google for like cloud and every other, all these services. So yeah, now we have Gemini and we have to learn AI. Probably from my tone of voice, you can tell that I am not a fan of AI. I think AI is going to take my job, but I am always a pessimist. So yeah, like I used it. Like I went to my account and I asked it to write me a regular expression. If you've ever had to write a regular expression, even though you've read the instructions a million times, you're still like, asterisk, period, like do I put like a parenthesis at the end? So I asked it and it was correct. So then I was like, great, it's gonna take my job because now it knows how to write regular expressions. So I went to Tech Tank to the workshop on Tuesday to learn about prompts. I'm trying to make friends with the enemy. But yeah, it's like you said, like it's great for, definitely I guess we have to learn to use it to automate the tasks such as regular expressions or writing TypeScript types and stuff like that. And hopefully I can work with AI. If you're listening, I'll work with you.
I just gotta point out, that's fucking awesome. But yeah, like, I mean, we weren't really authorized to do this, but there was like unit tests for form validations. And there was like a gazillion of those. It would have taken me 2 weeks to do it. I copy pasted the shit out of that. AI did the job and it was amazing.
I think with regards to like seeing it in the front line, I mean, it's not really made a debut in my hospital, but I've been reading about triage assistants. Like, you know, I think about the state of Ontario and we're lacking nurses, we're lacking doctors. And, you know, AI to take care of like certain tasks would be really useful, right, in this kind of environment. So in the US, I think there's some hospitals actually using triage assistants. And let me just give you an overview of the triage, what triage means. So basically, when a patient is checked into emergency, the nurse has about 10 minutes to take vitals, ask like the pertinent complaint and medical history, and then categorize that patient in terms of urgency to be seen. If they're really sick, they're gonna be seen right away. If they're not that sick, they're more stable, they can wait in the emergency room. So the triage assistant is really powerful, this AI. So they're able to access the patient's entire record. And then imagine that, like, you know, me being a doctor looking through multiple entries in the record and then being able to infer a risk of that patient dying, right? Including the vitals and the presenting complaint. That's a job for AI. And there's studies showing that it's actually pretty accurate. So perhaps like this could come to Canadian ERs maybe 20 years in the future. I don't know, but I think, you know, there's definitely a place for AI in medicine.
I have a feeling maybe before that all happens, someone will like an AI will show up in the ER, like someone will bring in their laptop and they've gotten really attached to their AI friend. It's like, it's broken. Can you fix this? It's gonna happen. So anyways, yeah, to maybe start kind of closing out this discussion, I wanted to ask each of you, you know, like what's something that you have noticed, you know, in your work or in your field that's there or coming that you're actually really excited about, that you think is really going to improve people's lives and think everyone should know about?
know about the excitement part, man. Like, you already told me AI is taking my job. Jeez. Well, yes, I'm in health tech, but at the root of it all, I'm a software engineer, right? So my field really is software engineering. I'm still a nerd writing code in the corner. I think the really cool part that's coming up is like, at least in the world of JavaScript, we are now building these huge, huge applications that are fundamentally like important to how we live our lives, how we take care of people around us. And it's interesting now that we're like, JavaScript is no longer the bad kid on the field, you know, shove it to the corner. Like, it is now an actual platform. And so my job, like technically principal engineer or front-end architect or whatever, is literally thinking about the architecture of it all, right? That didn't exist a few years ago. Like, that wasn't even a concept a few years ago. And now, like, I get to train other engineers, not in just thinking about the problem right in front of you, but how does that problem then evolve as it grows, as the product grows? So that plus AI is really cool stuff. I mean, hey, hopefully I still have a job at that point.
Would you like to answer?
I mean, there's a lot of things that have changed, like even, you know, since I was in med school, like, you know, the digitization of records like has made our lives a lot easier, right? The fact that I don't have to sift through paper notes to figure out a patient's diagnoses or what, you know, what the other doctor did, right? So I think I'm excited about this idea of wearable technologies now giving us more information about health that healthcare providers can do something about, right? So I think I was looking and I saw that they can now detect sleep apnea, right? They can detect movement disorders with your smartwatch, right? And this has like huge impacts, right? If we can use that information to pick up disease sooner, you know, this will really change healthcare.
Marta, remember the AI is listening, whatever you say.
Yeah, well, like I said, I am a pessimist, so as an engineer, I don't know if I'm excited about the future. League is still in the business of more like a consumer health, so like maintaining your good health and slowly moving into managing chronic conditions. I don't know, like engineering-wise, we are moving more into platformization and server-driven UI, which means fewer front-end work. So I'll see what happens in the future.
Awesome. With that amazing note, we will close out our presentation for today. Kiss my mic. All right, so we're going to take some questions now. And if I can grab Neil, or someone can maybe help like run the mic to people so we can maybe hear them. Oh, there's Neil. Okay. All right. Maybe grab one of the other ones that's working. Yeah.
Testing.
Okay. All right, cool. All right, hands. Yeah, right there.
Hey, can you comment on the risk and regulatory concerns imposed by the use of AI, especially with respect to health technology? I mean, a classic software engineering case study is the instance of Therac 25, where a concurrent programming error led to numerous radiation overdoses in patients who were subjected to this therapy. I'm somewhat skeptical of the application of AI without the oversight of an actual human software engineer to monitor and really supervise the output of these large language models.
Agreed. That's one of the reasons why I don't think, Marta, I really don't think I'm going to be fired. I think I will have a job for a while longer because the risk is high. Like, if we get our shit wrong, it's not just like, oh, oopsie, somebody's car's parked on the wrong lot. No, somebody fucking dies. So it really matters, which is why, like, on the health side, the risk aversion is high, right? So that's why I think AI being integrated in data analytics or like even in how the clinician does their workflow might be much, much later. But the first part is, I think, like having GitHub Copilot in your code, helping you write better tests, right? That kind of stuff, I think that's the first line. And that's low risk, because you're not really dealing with patient data. You're not really dealing with like direct patient problems. What you're dealing with is just a JavaScript problem or a Ruby on Rails problem or a Go problem, right? We're just engineers dealing with it. Like, take it one step back. So I think in that sense, heck yeah, AI can move forward faster, baby, help us do our jobs better. Like, and I don't think anyone is here gonna commit code without first reviewing that shit. And that's one of the biggest things with health tech too. Like, there's at least 3 to 4 people reviewing that code before it goes out. If you're working in a place where they don't review code, you should quit. That's a bad idea.
First of all, thank you everyone, to the panelists here. Thank you for sharing your experiences. I have one question regarding like purely development. So many a times, like most of the applications now, they are all data driven. Without data, they're basically nothing, right? And the more we are moving forward with time, data is going to drive everything. So my question is, there are times where we do need specific data for even while developing, and there are privacy concerns, right, to get certain data, even like sample data. So how do you, while development, how do you deal with that, and what are some of the strategies you use to overcome that?
So if you get an app through League, I mean, like for example, from PC Health, you have an option to first fill out a health profile. So you just actively give out your data, and then you get better recommendations for products, for health programs, and so on. But you don't have to do that. You can just go to the program library and pick your own programs. But then again, there's analytics. So pretty much everything you do in the app is tracked. It's not tracked to you specifically. It is anonymized, but then you know that users are more inclined to do this or that. That's how we measure engagement, and this is how we know when to improve the app, when it sucks and there is no engagement. So yeah, I think analytics is the main thing. It's always whenever you write a feature, like the last ticket is add analytics.
Any other questions?
Over here.
I saw some of
Can
these.
you hear me? Yeah, okay. This question's for Roveena. I believe you probably have the most experience with this. Are you familiar with this app called Figure One? Yeah?
No, I'm not.
Oh, you're not? Okay. Well, I'm
What
going to
is it used for?
I'm going to describe it this way. It's Instagram for the medical profession. So now that you're not familiar with it, I was just going to ask, because it was a Toronto startup that just got acquired like a couple months ago. But I just want to know if you're using it with like your students, because you're also a teacher, and if it had some kind of hospital application too. But if you're completely unfamiliar with it, this is a moot point, I guess.
I'm completely.
Oh, okay, cool.
But I'm curious. Is it like, what's the uptake in Canada? Like, are there a lot of Canadian physicians using it?
I'm going to assume yes, and it's actually internationally kind of known, because when I was following them early, it was kind of, they were getting, interests in other countries and whatnot, so.
What is it called again?
Figure One. And
Figure
it's
One.
literally.
Oh, yes, Figure One, okay. No, now that, like, you've jogged my memory, yes, I do, like, I think they talk about cases, right? Learning cases. Yes, I've looked at that app. I think it's turned up, like I did have, like I'm not so active on Instagram right now, but I think it's turned up on my Instagram account, and I think I've looked at the cases, and it is a useful tool to learn from interesting cases, right? These are interesting, rare cases that like you can bring to your residents and medical students and discuss.
Like more than teachers were commenting in the in the app. So they were all kind of helping each other. And I guess it was a tech app, even though it's really feels like Instagram, but a lot of just collaborative commentary. Hey, I've seen this before, yada, yada, yada. This is how I treated it. And it's been around for a while, so I just want to see if it sort of come across your table, but if it hasn't.
Yeah, no, I definitely, so yeah, like medical education is a big thing in our field because like there's always like things changing, right? Different protocols for treating different diseases. So every clinician has their own way to keep up to date on that information. I myself subscribe to like 2 different podcasts, like one in the US, one in Canada. And, but definitely like I can see it as a useful resource for people out there in my field.
Hi, my question is for Roveena. So you mentioned earlier about virtual meetings and how doctors can basically diagnose stroke patients and those sort of things. So in virtual attendance and meetings, a lot of the tangible stuff is lost in translation because you cannot really display minute differences in voice modulations or different things that doctor might look at. And over a virtual screen, that all gets lost in the details. So what are the other metrics and things that you would need for a successful or more effective virtual way for doctors to see patients, and what are your thoughts regarding that?
I mean, you're not, the doctor is there and then there's a nurse who's also like clarifying bits of information. So for example, they're relaying vital signs and things like that. You're right. You know, like when you're looking at a patient through a screen, it's very different to looking at a patient in person. So there are some features with our screen, like zooming, but even so, sometimes you have to like add on to that description, and sometimes there's a nurse who's relaying to the doctor, okay, like, you know, for example, with strokes, you're looking at facial expression, like droop, for example, and sometimes if it's very slight, you can't really get the resolution you need on the screen. So, you know, that physician might have to talk to family members and say, hey, does this person look a bit different? Is there a bit of more of a droop that you've noticed in the last few days? And you're not, you know, assessing that patient in isolation.
Hi. How much time do we actually have? All right, so I kind of want this event to end up on a positive note. I see a lot of worry about AI replacing the job of the software engineer. Well, I want to say I'm not as experienced as the wonderful people who did the talk for us today. It may be like because I'm a little bit more green that I'm positive about this. But the thing about AI is classification systems have existed for such a long time, but no doctor has ever been replaced by an AI for diagnosing a patient with cancer. It's because at the end of the day, these AI are trained using programming languages that work on a Turing system, a system that relies only on zeros and ones. So they are still prone to making mistakes. They confidently sometimes make mistakes, and it's still, you know, an experienced person's eye that can see this problem. When a classification problem, like a model, reaches 100% accuracy, it is dismissed as overtrained or leakage. It is never relied on for, you know, diagnosing a patient for something as severe as like a cancer like diagnostics or anything like that. And so I think, you know, at the end of the day, like these systems are designed on a flaw, because the Turing system at its core has a flaw, that it only relies on zeros and ones. I would say we are to worry only at a time when AIs start being trained using languages that are procured for quantum computers that are at NASA, where they rely on zeros, ones, and twos. So,
So
yeah.
So
That's
just
when you
wanna-
gotta like think that, you know, we are replicating an actual species rather than, you know, just a natural language.
I
of process.
just want to cover base here and say, we were joking. We're not worried about losing our jobs. We were being humorous in a pessimistic way. I promise you that. Because you're right, AI is not perfect. It can't replace us. Like, yes, I used it to do something as mundane as writing unit tests for very pure functions. But am I going to have it go figure out diagnostic solutions? Fuck no. Like, you know, like, everything's shades of gray. Like, there's no right and wrong answers all the time. Nothing is black and white. And, you know, the whole idea of like, if you do something in excess, that is wrong. Like, don't make those assumptions. Like, yeah, we were joking, and for anyone out there who is worried about, oh, being a software engineer right now is a bad idea, no. Please go be a software engineer. That is still a great job. Your definition of software engineer may change a bit. You may be working more with fine-tuning things as well, right? But like, there is change happening. I just think it doesn't mean we're gonna lose our jobs. I promise you it was just a joke.
Yes. And so I'm sure you've heard it like before, like if AI is going to like replace machines, you have to become the machine operator, right? So this is like, if like your coding job or my coding job is just like repeating the same things, then yeah, AI can do that. So like in embracing AI, what we're trying to do, what I'm like really trying to motivate myself to do is to like learn how to prompt it correctly and learn how to write things faster, write my code faster, documentation, that's a big one. Nobody likes writing documentation. It changes all the time and nobody updates it. So that's like another avenue where you can like show your great impact by using AI to update your documentation based on your code changes. I'm sure this is a great thing to do. I'll totally do it.
It's an assistive tool. It's not a replacement for anyone who is worried. We are not sending doctors out there with half-baked ideas to go diagnose people. I promise you.
Yeah, I don't see it replacing me at any point in time. Like, my job is just, it's not just, you know, coming up with diagnoses, right? I'm actually doing some treatments, doing some procedures. It's going to be a long while before that happens.
This does not mean that we can't have additional conversations. Obviously, all of our panelists are going to be around to socialize for a bit. We have basically 30 more minutes in this space to hang out, socialize, eat pizza. By the way, for those of you that don't know, because I don't think everyone's who probably wants a drink has grabbed one, we do have drinks that are free. Those gentlemen are not charging you for alcohol. I feel like this should be the easiest pitch ever. So feel free to grab it. I think we still have, what, three whole massive coolers of drinks. So obviously don't take them out of here, but try to help us finish them so we don't have to carry them. Outside of that, thank you for coming. We really appreciate it. Hopefully this is a really entertaining and engaging panel. A quick round of applause for our panelists. And also another quick round of applause for 7 Shifts for helping us sponsor this event, as well as Roof Garden. Yep. And I know we promised that when 8:30 we're going to kick you out, so remember that timeline, but that means we can just get to go drink again at a bar, which is going to be Hurricanes. It's only 2 blocks away, I think, a block away. Yeah. So when we shoo you out, you can kind of find your way over there. Outside of that, thank you for coming. We hope to see you next month.